Hi, this is Anu and you're watching Anaphonesis. Today we are going to review a very important organ, of course. The one that helps for you to communicate, the one that's helping you to listen to me right now. It's ear. It gives a beauty to the face, right? And also very important for communication. So the main functions are hearing and it gives balance and sense of position. The major functions of ear. When you think about ear, the first thing definitely comes to your mind will be the outer part. That's the pinna. And then you have got the ear canal, eardrum, and for the part of middle ear have got ossicles, then the inner ear. So when the sound waves comes, it will be collected by the pinna and will be going to the ear canal, and then it will be vibrating the middle ear eardrum and then the ossicles, and then the sound waves will be converted to signals. It's a neural signals by the microphone of your body that's called the cochlea, like a snail like structure. So this cochlea will be converting the sound waves to neural signals, and so that your brain will be interpreting what kind of sound it is. When you see the inner ear, the parts of inner ear are the vestibule, semicircular canal, and cochlea. Semicircular canals are the one that's helping you for the balance, and cochlea always it's connected to the auditory nerve. It means cochlea will be converting the sound waves to neural signals, and this will be taken by the auditory nerve to the brain. And auditory nerve is your eighth cranial nerve. And then you also have got Eustachian tube, and this Eustachian tube is connecting the nasopharynx and the middle ear. So this is in general and in short about the ear. Then let's see one by one, like a pinna. When you take the important things to remember, one thing is anosia, microtia, and macrotia. Anosia means absence of pinna, and when it is too short we call it microtia, and it's too big we call it macrotia. Pinna is a kind of cartilaginous structure, that when you touch and feel you can see there is no bone. It's a cartilaginous structure. Let me ask you one question. What is swimmer's ear is? It's otitis externa. Otitis externa is known as swimmer's ear. Now when you do the ear examination for children, how will you hold the pinna? You will be holding it downward and backward. If it is for adults, you will hold it upward and backward. That's a very frequent question for your exams. Now, the ossicles. Three bones are there: malleus, incus, stapes. Which is the smallest bone? Stapes is the smallest bone among the ossicles, as well as all over the body. When you take, the smallest bone is stapes. So what is the peculiarity of this malleus? You can call it a hammer-shaped bone. And what about incus? Shape of incus is called anvil. Anvil-shaped bone. This is the shape. And then the stapes, that's a stirrup. Stirrup-shaped bone is stapes. So remember, hammer, anvil, stirrup. This is a malleus, incus, and stapes. Otosclerosis mainly affects the bone stapes. What is otosclerosis? In otosclerosis, one of the bones of this ear, mainly ossicles, will undergo change. Instead of like a dense, thick bone, it becomes spongy so that it cannot transmit the sound waves. And mainly it's affecting the stapes. Usually we'll do stapedectomy, or sometimes we will be doing another procedure called fenestration. We will replace the spongy stapes with a prosthesis. So this is otosclerosis. The gland producing cerumen means ear wax in the ear, is a modified dash gland. Which gland is producing cerumen? It is whether it is sebaceous, sweat, or any other gland is the question. Yes, it's a modified sweat gland. Don't think since it's like a thick one, it can be sebaceous. No, it is modified sweat gland. What is the color of your tympanic membrane? Very important. I hope you know this. It's pale gray. If there is a blue color to your tympanic membrane, what is the condition called? Blue color is usually seen in otitis media. And in case of some trauma, you can see a dark red color. And in some kind of otitis media, you can see because of hyperemia, it can be light red or dark pink in color. This blue color you can mainly see in serous otitis media. And sometimes, one more thing, more than the color, the more important for the diagnosis is the tympanic membrane's position, whether it's like in the neutral position or it's bulging and all. In acute otitis media, the tympanic membrane usually bulges. That's a more significant thing than the color. Next thing, repair of the tympanic membrane is known as meningeoplasty, or you also call it tympanoplasty. The spiral shaped bone of inner ear, cochlea, you also call it snail shaped bone. The tube that connects nasopharynx and middle ear, already I mentioned before. Yes, it is the Eustachian tube. And remember, Eustachian tube is around 4 cm long in adult and less than 2 cm in infants. When you see the structure, you can see it's roughly a shaped, or you can say hourglass appearance of Eustachian tube. But in infants, it is very short, straight and wide. That's the reason why children are getting frequent ear infections. Hearing loss. How many types of hearing loss you know? Mainly there are conductive and sensory neural hearing loss or mixed hearing loss. So in conductive hearing loss and sensory neural hearing loss, what's happening actually? In sensory neural, it's mainly affecting the cochlea or the auditory nerve. It's mainly related to neural. It's all related to your neuron problem. So it's cochlea or the auditory nerve. If it's affected, it's mostly the sensory neural. And in the conductive, the main problem will be in the pathway, whether the problem in the canal, too much of wax or fluid in the middle ear, or otitis media, or is there any problem with your tympanic membrane. All these can affect the conduction of the sound waves, and this is called conductive hearing loss. If this both are coming together, we call it mixed type of hearing loss. Now the most important test we usually do are Weber's and Rene's test. What's Weber's test? When you strike and place a tuning fork in the middle of the head, say on the frontal bone or anywhere on the middle of the head, if the person is hearing equally in both ears, it is a normal test. I mean, the person has no hearing problem. It's a normal interpretation. So what happens if abnormal? In case of abnormal, one ear they hear loud. One ear they hear louder. That means they have either conductive or sensory neural hearing loss. If it is conductive loss, they cause more sound in the abnormal ear. And if it is sensory neural hearing loss, it will cause the sound to be heard best in the normal ear. That means if I have sensory neural hearing loss of the left ear, I won't be able to hear anything on left side. I'll hear on right side because my right side is normal. And if it is conductive hearing loss of my right side, I can hear louder on right side. So that's the difference in Weber's test, and that's the interpretation. And the tuning fork unit also you should be remembering, it's around 512 hertz. That's the in that frequency you will be vibrating it. Next is equally important, Rene's test. Again, you will be using a vibrating tuning fork of 512 hertz, and you will place it over the mastoid bone. And the normal interpretation is air conduction should be more than the bone conduction. That's almost twice more than the bone conduction. So when you keep it on the mastoid bone and the patient says they cannot hear it anymore, you will place it in front of the ear. So what happens when you keep it in front of the ear? Again, they should be hearing it normally. If they are not hearing, that means it's abnormal. That is, bone conduction is more than the air conduction. That means a negative Rene's test. Positive Rene's test is a normal interpretation and negative is abnormal interpretation. So this is about Weber's test and Rene's test. Now I'll introduce you some common ototoxic drugs. The list is like, it's not limited to this, but most common drugs you should be familiar with are NSAIDs, especially aspirin, ibuprofen. Then some antibiotics like aminoglycosides, vancomycin. In aminoglycoside, you should be remembering about anti-TB drug. Most common question area, that's a streptomycin injection. What you are using is a ototoxic drug. Then vancomycin, another antibiotic. Then loop diuretics. Very good example is Lasix, and anti-malarial drugs like chloroquine. Some chemotherapeutic drugs like cisplatin, carboplatin are common ototoxic drugs. Sensory neural hearing loss that's associated with aging is called presbycusis. What's the peculiarity of presbycusis? I don't know whether you have noted, like if you have your grandparents at home, if you say something secretly, they will be hearing it, and when you say something, when you shout at something, they won't be hearing it properly. So their ears are more sensitive to low tone voice. It's called presbycusis. Thank you for today, and we'll be continuing with the part 2 of ear, and see you again. Bye.